name is Frank Claybrooks, and I'm from Eastern Pennsylvania.
Mr. Claybrooks had very early prostate cancer.
Every 3 to 5 years, I would actually have a biopsy done. And it was through one of those biopsies, that the PSA and the biopsy, that we found it.
In the United States, close to 250,000 men are diagnosed with prostate cancer a year.
The world came to an end when he came home with the news that he had prostate cancer.
My urologist that I was going to locally there, I started to talk to him, and of course, he did not do robotic surgery.
Around 1998, people started using laparoscopic surgery or minimally invasive surgery for prostate cancer. Very, very few patients were being done, maybe 10 in the United States at the time that we started doing robotic surgery.
But as I started to do research and what I wanted to do, I looked at Henry Ford and said, everything I read said this is the best place to come for the experience.
The VOI team itself has done about 3,800 prostate operations or radical prostatectomies.
The one thing that tipped the scale for me was the length of time that they had been doing robotic surgery here at Henry Ford. And then the other piece was the experience of Dr. Menon himself and the reputation of Dr. Menon himself that drove me here.
He opted to have surgery. The conundrum then that I was faced with is, how can I do the surgery minimizing the side effects? And the operation we did on him is the Super VIP, which is an operation that at this point is just done at the VUI.
In making arrangements to come here, it was very easy.
The out-of-town patients are going to come in usually the day before, so they're getting themselves comfortably in an accommodation.
They offered some options for us even coming here. Would you like to stay here on campus, or would you like to stay out at the Ritz out in Dearborn?
We've tried to mimic a patient's experience coming from home. We've tried to put ourselves in the mindset of a patient. What is it we would need if we were to have surgery?
From the time we walked through the door, they had both the nurses paying attention to us, the people that were handling us from a reception standpoint were very nice and very cordial to us.
Our concierge individual who actually we borrowed her, stole her from the Ritz-Carlton, so she had the training, the extensive concierge type training, so she's very, very good at what she does.
It was no surprises when I came into the Institute and the time that I was supposed to be there.
They get exceptional care here. The care goes beyond the actual operation.
We offer our educational programs, our hotel stays. We offer support groups for our men.
What they provided for us there was a lot of reading material, of course. They provided a lot of counsel, sitting down and going through some counsel with us early on.
You know, to be there for them, to offer that 24/7-hour care for them is very important in making them feel comfortable.
They took time to not only to sit with me and talk with me, but showed me around the building there.
They then are seeing the next day, meeting with Dr. Menon in a formal consultation.
Dr. Menon himself took a lot of time sitting down and talking to us about what was going to happen.
My goal to him in approaching him was, I know that I'm going to be able to cure him of cancer. I don't want him to have the side effects of sexual dysfunction and urinary incontinence. And so the operation that we did, something that we call the Super VIP, was the most sophisticated version of this operation that minimized these side effects.
I think I'm very satisfied with where I am today with the results and what I told the results were going to be.
We don't have a lot of patients that are complaining of ongoing incontinence. Yes, of course, in the short term, there will be some leakage. It's known as stress incontinence for the most part.
2/3 of men who undergo computerized prostatectomy, using these specific techniques, 2/3 of these men have complete urinary continence the day the catheter comes out, the day the tube tube comes out.
Once the catheter was removed, my experience was that I had complete control, literally within 3 days after the catheter was removed.
The robotic patients are up within a day. They're taking very few pain medications. It's a much easier process. Certainly, if anyone were to ask me, open procedure versus robotic, hands down, robotic.
They actually had a sex therapist spend some time with us. And you have to learn how to enjoy each other in different ways.
And that is probably going to include a drug like Viagra or Cialis, known as a PDE5 inhibitor. They're also going to be encouraged to use a vacuum erection device. And they're also going to be taught and preferably use penile injection therapy.
We are able to maintain erectile function in about 90% of men, whereas without this, it was 1 to 2% of men at 6 weeks who were able to have a sexual erection strong enough to have sexual intercourse.
It's nice.
We encourage all the patients to come back, and the follow-up will consist of a few phone calls. We have some key individuals who will make our phone calls to the patients roughly about a month after their surgery.
And then we'd like to see them back at 4 months. At that time, we reevaluate how their cancer is, reevaluate how their urinary control and sexual function are.
Even when I come back here, they act like that they truly remember me and know me, and I know they have thousands of patients coming through all the time, and they treat you as if you're a special one. And I'm sure they're not doing that for Frank Claybrooks. They're doing that for every patient that walks through the door.
I'm telling you, the scope that's here at Henry Ford for this it's unreal.
Looking after patients is a great thing to do. The passion that the patients have to us, the loyalty that they have to the program, it's actually humbling.
They are emotional when they come in. They say that they've never experienced anything like this in any healthcare setting ever before. It's a personal touch that we give our patients, and we have many, many services that we offer that no other institute would offer.